Meningitis. First, let's go back and talk about bacteria a little bit. Bacteria can survive without hosts. They just use the hosts for food and shelter. Bacteria can be aerobic, requiring oxygen, or it can be anaerobic, meaning it can survive without oxygen. They also can produce toxins. They can infect and reinfect until they are finally destroyed. Some bacteria are encapsulated. When that happens, they are adherent. That means they can attach to the host cells, stick to them, and they are resistant to phagocytosis. Endotoxins. Some bacteria produce endotoxins. Endotoxins are part of the gram-negative cell wall. The endotoxins activate plasma protein system, which causes inflammation mediators to be released. Then there's a massive inflammation response, and the person can go into shock with fever, diarrhea, and leukocytosis. Some bacteria create endospores. That means they become spores and can remain latent, just sitting around lurking, not doing anything, just waiting. They're waiting for a favorable environment. Maybe the person's temperature to come down, maybe the antibiotics go away, but all that time, because they're in a spore, they are resistant to destruction. Some bacteria make exotoxins, and these exotoxins cause the host cell to dysfunction and to undergo lysis. That means destruction. There's local or systemic injury to the host, and the targets of these exotoxins, sometimes it's the brain and spinal cord, then it's called neurotoxic. Sometimes it's the GI system, then it's called enterotoxic. Sometimes it's the liver, that's hepatotoxic, the blood, hemotoxic, and etc. So these endotoxins and exotoxins, they're essentially poisons to the system that's coming from the bacteria. So what does the host do? The body tries to get rid of the bacteria, and it's willing to destroy itself, destroy its own tissues that are surrounding the infection to do it. And they do this via the inflammatory and immune responses. Alright, now we're going to talk about bacterial meningitis. Bacterial meningitis is most commonly caused by gram-negative bacteria. And I'm not going to try and say this, but that's the one we're talking about today. Bacterial meningitis is an inflammation of the meninges of the brain and spinal cord. The meninges are the membranes. And in these pictures here, you see they've got a couple different layers of membranes, the dura mater, the pia mater, and the arachnoid. Those are all the meninges. So all those layers become irritated and inflamed. Bacterial meningitis is spread via respiratory droplet transmission. The bacteria enters the respiratory tract and attaches to the epithelial cells that line the respiratory tract and start to do their destruction there. How exactly they migrate to the central nervous system is not yet known. But there's an inflammatory response. Remember, that's your vasodilation, vascular permeability, edema, exudate. And this causes the brain tissues to become edematous and hyperemic. That means filled with blood. The exudate accumulates throughout the cerebrospinal fluid, causing damage to cranial nerves, obstruction of the CSF pathways, obstruction of blood flow to brain tissue, and reduced oxygen to the brain. Bacterial meningitis can result in septicemia. Okay, what are the signs and symptoms? Irritation of the meninges is associated with a severe headache and photophobia, which is light sensitivity, and both of them have a rapid and severe onset. There's nuchal rigidity, that means a hyperextended stiff neck. There's an increase in the intracranial pressure from brain edema and resultant hypoxia. This causes or can cause changes in mental status and loss of consciousness. It can also cause vomiting and seizures. To diagnose this, obviously you're going to do a history and a physical examination, and that includes the Kernig sign. When you lift the leg up, it should cause pain. And the Brudzinski sign, which is when you lift the head up, it's going to cause pain, and the person's knees are going to come up automatically, like in this picture. Other ways we diagnose bacterial meningitis. Blood and cerebrospinal fluid, we look at it, we analyze it, we send it for cultures. And we need to remember that mortality is 50 to 90% if we don't diagnose this until after the onset of severe neurological impairment. So what do we do for bacterial meningitis? Prevention is the key. There are immunizations available to some of the strains. We use antimicrobial drugs, antibacterial drugs. We treat whatever symptoms we can, and very important, because it's droplet transmission, you treat everybody else that's in their immediate environment. You treat the people they live with or that they work closely with. All right, we said it can move into septicemia. What is that? Another word for it is bacteremia. It's the bacteria gain access to the blood. Remember, blood goes everywhere. So this is an overwhelming systemic infection. A person's response to septicemia is based on the pathogenicity of the bacteria, how strong is it, and the immune status of the host. How well can the host fight it off? Okay, bacteria have access to all tissues. Think about it. The inflammatory and the immune responses are happening in all body sites and organs. It can be devastating, and it can actually move into septic shock, which is a systemic vasodilation, especially if we're looking at gram-negative bacteria. We're much more likely to move into septic shock. Massive vasodilation, that means poor perfusion of the vital organs. The blood's not getting there. If the blood's not getting there, the oxygen and nutrients aren't getting there. So we have multiple organ dysfunction. We will also see fever, vasodilation, and a warm, flushed skin. Abrupt changes in personality and behavior may be the earliest signs. If we look at vital signs, we're going to see an increased temperature. They've got an infection, right? But we're also going to see changes in the blood pressure and pulse. Because the person has systemic vasodilation and vascular permeability, we have a relative state of hypovolemia, so there's a drop in blood pressure. Well, this drop in blood pressure and the hypovolemia means the blood is not getting to all the extremities and the organs and the body tissues adequately. We have poor perfusion, so the body tries to compensate by increasing its pulse.